Diabetes remission, type 2 diabetes remission. If you've just tuned in, you are here for a couple of reasons. Maybe one, you've heard about diabetes remission. Maybe you're on a weight loss journey, or perhaps you've just decided that there has to be another way to successfully manage your blood sugar. Well, tuning into this conversation, I can assure you that by the time we finish this conversation, you would have more of a clear understanding of what actually is type 2 diabetes remission and why should it be something at the top of your goal list. Second, you'll learn the language or the lingo that's needed to have with your healthcare provider. We're going to talk about the ideal candidate for remission, and of course, the steps that you can take to actually achieve it. So throughout this conversation, it's going to be a basic level conversation, but at the same time designed to empower you to seriously consider if your circumstances or situation will allow you to consider looking at remission as a goal. So I have a really cool visual to help guide us through this. And feel free, go in the chat. You got a personal story, you want to share a story, you want to share a goal. Let's get excited about the chat. I want to give a woohoo thank you to everyone that's tuning in live. Once we record this, then I turn that recorder off and we'll get to have some time for you to dive in and ask questions if you like. But in the meantime, feel free to use the chat. What is type 2 diabetes remission? I'm curious if there's anyone on that can use an emoji or hand raise outside of some of the posts that you may have seen on Amani, Nicol Wellness social channels. Have you heard the term diabetes remission? Have you heard that phrase? Has someone clearly defined it for you? Well, our definition of remission comes directly from the American Diabetes Association. Through extensive research and data information, they are now using this term, and they're going beyond using the term. They're telling us, based on their findings, what it actually takes in order to reach it. So the great thing about this is just know that this isn't something that just landed, that this has to be a possibility, because here's the reality. If we can lower blood glucose, if we can reverse prediabetes, which is that period where your glucose levels have not quite reached type 2 diabetes, however, it is high enough where blood glucose is compromised because insulin is now resistant. If we can reverse that, if we can take a person whose glucose levels are between 5.7 to 6.4 and help them through lifestyle changes reach an A1C level of 5.6 and below, then what does that say for someone who is aiming to manage type 2 diabetes well? Well, remission can happen. And for those of you on this call who are considering it, it can happen for you. So how do we get there, and what is it? Blood glucose levels have to reach the non-diabetes range. Now, I just talked a little bit about the pre-diabetes range, right, which is 5.7 to 6.4. The non-diabetes range is 6.4 or less. So they'll say your hemoglobin A1C has to be less than 6.5, or your fasting glucose less than 126. So when we think about this, I want to focus on A1C specifically, because as we talk about what are the steps and how you accomplish it and achieve it, it's real important to note that the hemoglobin A1C is a great test to put in top tier, because it is an average of your blood glucose levels over a period of 3 months, right? So we want the A1C to work things out in this situation. And this criteria again, as I mentioned, is recognized by leading organizations, including the American Diabetes Association. When you reach these levels, though, what defines that you are considered remission from a clinical perspective? Um, how do you get there? Well, before I move on to the next slide, remission has been achieved once you're able to reach a non-diabetes range for a minimum of 3 months consistently without medication. Let me say that again. Your A1C is less than 6.5, and you have managed that number consistently for 3 months without the support of medication. When we think about remission, it's a big goal. It's a goal that is more than achievable. But as we guide through this program, you want to ask yourself, where are you now in your phase of health? If you are diagnosed with type 2 diabetes, or there's someone you're showing up for them, and you know what their A1C is, you know if they are on medication and they are sticking to their treatment plan, right? You know where they are. And so, which is why diabetes remission, although it is possible and it can happen, we want to know where we are in terms of our current diabetes health. And how, I'm not even going to say how realistic, because this is realistic and we need to be having these conversations. And some of you may know that there are people with lower A1Cs, that they may have been diagnosed with type 2 diabetes, but their A1C has been below 7 for a long time, but they could still be on medication. So this conversation about remission is not just based on someone who may not be managing it well. We have to have this open conversation because there are a number of women who are in what we call that glucose management cycle with their A1C. And what is glucose management? What is effective glucose management is when a person who has type 2 diabetes has an A1C at 7 or less. That hemoglobin A1C is 7% or less. That is considered successful, effective glucose management. So someone who has an average of a 7, it's at 7%, when will their healthcare provider or their physician talk about diabetes remission? Because they're this close. What if there's someone whose range is in the 7s, and maybe it's being managed by medication, which is fine. But has that person talked about, okay, what are my options in terms of medication, especially if they're thinking about no longer having to be subject to it? Then what does that look like? So the conversation on diabetes remission has a multi-pronged approach. One, it's for that person who says, hey, I want to do something different. I know that lifestyle changes can be effective, but I know that my healthcare team has to be a part of this decision as well. Someone who's looking forward to diabetes remission also sends the signal that eventually they want to be in a position where medication is not doing the work for them. They want to do the work. Couple of things we want to recognize about remission. I'll say, feel free to use that chat feature as well if you have any questions or you have a thought. Knowing that diabetes remission is possible, y'all, we want to take this conversation back to others so that they're also equipped to have those necessary conversations. And although remission is not considered a cure, but why is it not considered a cure for type 2 diabetes? It's not the cure, but it's a great place to be, because we all know that when glucose is elevated, when our blood sugar is elevated, when blood is compromised, blood vessels are compromised. Our organs are affected by it. Our quality of life is affected by it. Remission should be the goal for everyone, but we know that it is not considered the cure because our bodies still have to acclimate. Our bodies may still have to deal with some of the challenges that were brought on during a time where our A1C may have not been managed well. But the good news again is that you are in a position where you're preparing your body to rejuvenate to this new phase. Remission is not a cure because we know that ongoing lifestyle changes have to continue. You know, consistency was one of the words from one of our classes yesterday. We always ask, what's the word of the week? What's that positive word that's going to keep you motivated? A lot of us say consistency because we know when we become consistent in an action, amazing things happen. So this goal, when remission is the goal, it is not just about 3 good months of putting in the work to get that A1C less than 6.5. It really is a longer term thinking. This is your strategy. What you're building today is your strategy session. And you're in a mode right now where we're going to fast forward, knowing where you are right now in your current health, in your current place. How realistic is type 2 diabetes remission for you for 2026 before the year ends? How realistic is it? How close are you? While we know that we can relapse, perfect does not live here, but let's check these facts real quick. Let's just talk about this thing here, right? Because we want to stay positive, but at the same time, we want to be realistic. But let's just think. When you have put in the work to reach glucose levels less than 6.5, life may show up from time to time, but if you have built up a consistency with even some of the healthy lifestyle habits, we can rift, we can have a relapse, but what are the chances of you going from 6.3 to 13 in 3 months? I'm just saying, when you reach the success level of remission, that is a true celebration. It should be celebrated. And your hard work and efforts and the tribe that supported you to help you get there, while we know that blood glucose levels are also driven by stress factors and things can change from time to time, that the focus here is really building up these lifestyle changes that fit where you are. Every single one of us on this call is doing something right. The first points, the brownie points come from you being live in this discussion right now. But this isn't the only good thing that you're doing. There's something positive about the way you are treating yourself right now. It has to be at least one thing, because that one good thing, the one thing that's working, the one thing that you are doing consistently, and I share this all the time, can we be consistent? Absolutely. What are you consistent in on a regular basis? Because let me tell you something, bills due. You already know what's due. What's due by the 5th? What's due by the 15th? What can you stretch out to not have to pay till the 27th? So we will consistently get up and show up at work. Even if we don't want to be there, we know that when we put forth that effort, that we're going to be able to take care of some things. That although you might not get up in the morning doing a happy dance to get to work, it serves a purpose. And sometimes in this journey to better health, I'll call it, yes, I'm going to talk about weight loss a little bit, but I'm going to tell you at the end of the day, when the focus is not the scale, although the scale, we're going to talk about it. But when the focus is not the scale, especially for women over 40 who are dealing with multiple hormonal changes affecting the way those numbers look on that scale, we want to find another way to build momentum and a desire. I'm not saying motivation, y'all, because I really feel like in some cases motivation is so played out. Motivation can keep us stuck, however you define it, right? Because for some of us, a defining moment, we have told ourselves what has to happen in order for me to decide to jump up and make it happen. That is not motivation. For some of us, we literally reach a point where we go, no, this is just what I'm doing. That holds a lot more weight because motivation does this. Oh, I dropped 3 pounds, but next week it doesn't move. Well, good news, you've maintained the three that you lost. That took work. But if I'm only motivated by external things, then how effective will my journey be? Literally, and I'm just going to say it as a mindset coach. I'm board certified in behavior change, y'all. I done read the books. I had to sit through class. I'm still learning, but I will tell you, the theory of change is an interesting theory. The beautiful thing about the theory of change is that we do not have to be 100% ready to change every aspect of our health in order to see results. There may be one thing that we can do well or be consistent with doing that will help us to reach the goal. So let's circle that back into why remission is possible. One, I already told y'all, number one, you're consistent in something. So it's not that you don't know how to be consistent. You are consistent in something on a daily basis. The question may be the what is a challenge for me to be consistent in terms of our health goal? Well, by the end of this conversation, hopefully you're thinking about that in a way that you can overcome that. Remission is possible because let's talk about the weight loss effect. Just losing a small amount of weight can help us to improve our insulin. It's the excess fat that affects insulin. So, how do we do this? We aim to remove what we can in terms of our body fat percentage. When we lose weight, it's going to improve insulin. It's also going to improve cell function, right? Because remember, with diabetes, when our blood glucose levels rise, that means the blood flow is compromised because sugar, glucose, is not able to move to the cells and give us the energy that we need, y'all. You're just tired of being tired. That may not be, this term motivating y'all. You're just tired of being tired, so you want to do something different. Give yourself the inner credit because you've said, today I want to do something different. So we talked about the two things. Notice we're talking about that fat accumulation, y'all, that visceral fat. That's the stress fat. That is cortisol. That is a combination of some of these hormonal changes, y'all, but they're driven by how our bodies manage stress. So pause for a moment and just think about, what if I substituted the word weight loss with stress management? What if instead of some of the weight, the complexities, how hard it can feel at times to think about the weight loss, what if we focused on how we manage stress? That's the mic drop. If cortisol is a culprit for this excessive fat that we deal with, that belly fat, if cortisol, the stress hormone, affects what we do, how we think, what we say, if stress is affecting sleep, which affects weight gain and also affects blood glucose levels, then what if I made my focus stress reduction? Well, the other great part about remission being the big goal is that you recognize that you are increasing your body's overall ability to function well. When the liver and that pancreatic fat improves, glucose is regulated. Y'all, the body is magnificent. It is magnificent. It will do whatever you tell it to do. And here's the key, and this is what we're going to focus on for the duration of our conversation, that lifestyle changes can reverse those key drivers to the hyperglycemia. Whew. The nerd girl in me wants to send cheerful emojis because the body itself has the ability to turn the key to turn that key so you can turn that car in a completely different direction. So I hope you are ready for the journey to type 2 diabetes remission. How are we going to get this thing done? Well, one, remember I said we're consistent and we should not have to worry about how difficult this journey could be, right? You know where you are in terms of food. You know where you are in terms of exercise, sleep. You know if stress is stressing. Know where you are now for a baseline and recognize that you do not have to do a 180 to start this process. Clinical data shows that now, but notice it says clinically guided. Can we all lose weight on our own if we put our mind to it? Yes, we absolutely can. When it comes to remission, it is a team effort to work alongside your clinical team and your partner in programming. So this clinically guided weight loss, look at this number, y'all, 5 to 15%. So you mean to tell me that someone who weighs 200 pounds, if they lost 10 pounds, could literally change their blood glucose levels? Yes. What is your 5% goal? And we're talking about a start, right? Your start don't have to be 50 pounds. You might want to lose 50 pounds, but it's not going to take 50 pounds to get those glucose numbers where you want them to be. 5 to 15%. When we think about nutrition, we already know, oh yeah, Nick, the healthy foods. Let me try to eat healthier. Okay, I'll do that. I'll take it to the next level. The slide says minimally processed foods. The slide didn't say kill the meat, don't eat meat. The slide didn't say only eat one meal a day or try not to eat food so that you'll lose weight. So the reason why the clinically guided weight loss, what that simply means is that there is a structure to how weight loss is happening. We need a structure because the last thing that we want to do is start the course, but we miss key elements that will make the journey effective, right? When our blood glucose is compromised, there's some things we have to do a little bit different. And so it requires some guidance. When we think about this nutrition focus, here is where you can ask yourself, hey, am I surviving off of 2 meals? Yeah, I'm gonna tell you, even with intermittent fasting, and I say this all the time, there's a right way to intermittent fast, and when a doctor describes the best way to make it happen, it never says eat less food. Intermittent fasting is based on the circadian clock, not this idea that you eat less food. Because most women, we're not eating enough food anyway. So how do we position ourselves where nutrition actually plays a role? That we're building up the nourishment is what I refer to nutrition. How are we nourishing the body? And from a clinical perspective, what is the best way to nourish a body in order to reach remission, the steps that it's going to take? We're not saying no to carbs because we need carbs. Carbs are our energy. And we know that there are better carbs than least healthier carbs. We know that there's fructose, which is natural sugar, versus the added sugars. We also recognize that while men and women have to be mindful of protein, but that we need adequate protein. where a lot of us are tired, and this tiredness is not just from the weight of the world on our shoulders. The tiredness is from our bodies, inability to be nourished completely. Why? Because stress can keep us from desiring the foods that can help us along the way. So, key steps here is recognizing that your weight loss goal, and now here's where we want to get specific. For those of you that want to hang out and work with us, there is a tool that we use to help get as clear as we can about the body fat percentage, which is why we know when we talk about weight loss, that 5 to 15% in our world is based on a 5 to 15% reduction in body fat, because that reduction contours the body naturally and it helps to change numbers overall. While we have a focus on type 2 diabetes remission, please keep in mind that the same lifestyle changes that are needed to get those glucose levels in a better place are the same lifestyle changes that will help us to be able to lower cholesterol if you're dealing with cholesterol health concerns, the same lifestyle changes that can help us to stabilize blood pressure as well. Because basically what we want out of this whole process is to be heart conscious, heart healthy, and healthy overall, not just one diagnosis, because blood glucose affects the entire body and it can lead to other chronic conditions and metabolic syndrome, which is a combination of chronic conditions, including obesity. So let's talk a little bit about the foundation. On a scale from 1 to 10, how would you rate your current exercise routine? Be honest. You don't have to put it in the chat if you don't want to. I love that. I see that, Miss Jackie. We know what you do. I want to be a walking warrior too. So rate where you are, because this is part of the process, right? This is the baseline. This is where you are. Regular. What is regular physical activity? It's moving every day. But what does it consist of? There's evidence, you've all heard it, 150 minutes a week. How do you get the 150 minutes a week? It's clinically proven. Do you have to get 1 hour at a time? Does it have to be in 30-minute increments? The beauty of exercise, I'm just going to pause on, I'm just going to hold here for a minute in the exercise space, because when you are crafting this journey, which I hope feels fun, that it feels invigorating, that it feels less of a challenge and more empowering, because you are turning a page to a new chapter. And this new chapter speaks volumes to not just how you improve blood glucose, but how you improve you. Because when we feel better, we do better and we do more. When we feel better, we are much more clear in our decisions, y'all. And when we are clear, guess what we do? We stop doing too much because we're in a place where we're able to clearly think about our actions, and we're more conscious about making sure that we don't overburden ourselves. We can still be those giving, nurturing creatures that we are designed to be, but we're not overburdening ourselves, including not allowing ourselves internally to overburden ourselves as well. So why I want to pinpoint this when it comes to regular physical activity, because as you think about where you are currently with it, think about what that number is. How much exercise are you getting, if any? Sometimes the consistency picks up when there is a goal associated with exercise that has nothing to do with the numbers. We know about the 150 exercise minutes a week. But what if you need something else? What if recognizing that exercise is not just going to help you manage blood glucose? What if now the exercise has become an extension of your emotional wellness? What if you recognize that you're now in the flow because every time you exercise, even if it's just 5 minutes at a time, you feel relaxed. You feel the relief. knowing that when you exercise, you open up your body's natural pharmacy, the endothelium, one of my favorite words I like to say. Look that up. The endothelium activates when you move, and it does not take long to activate, but it is literally our body's internal pharmacy. That is what it is. It helps with blood flow, it helps with oxygen flow, it tells the body that you are in love. So maybe this idea of exercise, if it sounds a little complex, if it sounds boring, girlfriend, jazz that thing up. Because exercise can be whatever you want it to be. It could be that Saturday morning, Sunday morning, old school mix while you cleaning, exerting that energy. It could be that YouTube video influencer that fits your schedule perfectly because you can turn it on whenever you feel. Or maybe it is that gym membership because you have a gym buddy, or maybe even a spouse that's like, come on and hang out with me at the gym. Your physical activity routine, where it is today, what will it take to level it up? Be realistic, as transparent as possible. And again, if it sounds boring, put some whipped cream on it. Figure out how you can make this thing fun. Sleep quality. Oh, sleep is underrated, y'all. Sleep is up there with the exercise. Blood glucose is affected by sleep. Remember, y'all, blood needs to flow. It needs to navigate through the vessels and help the body to receive the much needed oxygen and blood flow that it needs. When we think about sleep from a cellular perspective, y'all know that sleep is the natural rejuvenator. It rejuvenates us. You may have heard me use my favorite analogy, y'all. You would not drive your car home from work, park it, and keep the key in the ignition so it could run overnight and wait for you to get up in the morning to get in and then drive off. You would give that car a break because you want that car to have longevity. You got point A to point B to get to. You're going to get that oil change. You're going to get the transmission fluid topped off. You're going to get new tires and then get them rotated. You're going to change the windshield wipers. You're going to keep that object that can easily be replaced at any time well enough to move and do what you need it to do. It's the same for us. That car gets to take a break. When do we allow ourselves, our body, the brain, the heart to turn off so it can rejuvenate? The roadway, or I should say the roadmap to remission is exciting. When you think of remission, I can't help but think about the word change is right there next to it. What changes can you see yourself deliberately make over the course of a few months in order to make this happen? The beauty of being fully transparent and fully aware, especially in what we call lifestyle foundations, is that you're going to peel back some layers. Some of these layers will be super deep, but at the end of the day, the more peeling you do, the stronger the journey and the stronger the outcomes. Be transparent. When we want consistency to happen, it's going to happen, and it's going to happen in a progressive level. But remembering that your consistency overall, I love this phrase, y'all, metabolic stability. We know what it feels like to be unstable. You know, we could at times feel unstable in thought because we're juggling too much. If we've ever had to make a big change really quickly, maybe move to a new place, maybe switch jobs, maybe we get, a new boss, a new supervisor, any moment that you've had in life where you felt unstable, just things were out of whack. They were all over the place. It just felt like the thought of things aligning felt like a distant dream. our metabolic health is in a state of instability when it is not able to function the way it truly wants to, the way that we want it to. And this is non-judgmental, right, y'all? These things happen to us, and we, find our best way of dealing with some of the challenges that we face from a health perspective. And it's real, it's natural, it's not, it's common. But we don't talk enough about metabolic health so that we can just simply understand that when even one thing is off, like glucose levels, it only takes one thing. The body is the most harmonious example of working together. I mean, I love an orchestra. I love classical music. I like trap instrumentals too. And I'm a hip hop girl. But it's something about the classical music. It's something about the maestro with just, he just has this flow to the regular eye with no clue. It just looks like he's just twirling around these sticks and everybody else just knows what to do. But there's an art and a flow and a skill to that. Now, the moment one of those sticks leave his hand, if it throws off, guess what? The whole orchestra is off because the orchestra is following him. The orchestra is following the lead. That one thing throws everything off. When we begin to look at our health from that perspective, that metabolically, if one thing is out of line, everything else is compromised. And so, we get to the good part, the fact that we can align things back. Your metabolic health, what will you do? So, because we are talking about metabolic health, it's important to note that for type 2 remission, it is a team effort. So most of the work, you're going to do the work. You're going to create this strategy for success, and you're going to have partners in place to help make it happen. What does the clinical support look like? Well, you can ask yourself, how often are you now seeing your medical providers? What will they say when you say, hey, this is what I'm going to do, not what I'm thinking about? If remission is at the top of the list, this is what I'm going to do. This is what I see in my health future. And how can you support the efforts? So as you're going through this, because remember, someone who's looking forward to remission only happens without medication. So that's a big decision, and that's a decision requiring the support of your current healthcare team, especially if you have been prescribed medication to manage your numbers. That's a big conversation, because that question becomes, okay, then at what point in my progress, like how much progress do I need to show in order to feel comfortable enough to begin the start, the green light to working on remission? We have to track the A1C. It's important for you to track where you are with other metabolic markers. And what are those markers? We mentioned it, your cholesterol health, blood pressure. They're playing a role in this. And how great will it feel to know if any of those other areas are elevated? Well, what do you think they'll look like once you hit remission? They should look pretty good. There has to be some structure for long-term success, because once you hit month 3 and remission is official, the support should not end, because the goal is to keep you going. So quick question on clinical monitoring. Feel free to put this in the chat as well. How comfortable are you with your current healthcare team? Are they supportive? If you have a team that listens, we know these appointments are brief. They're 15 to 20 minutes, but do you feel like you have a provider who's willing to listen? If you do, that's great. If not, hey, that's a whole nother step to the journey. Is it time to ask for a referral or recommendation? Or maybe could it be that the clinician just needs an opportunity to get to know you a little bit? Maybe this current physician that Maybe the bedside manner isn't bad. They're just in a rush. He's a human too. Well, she's a human too. Maybe you're that patient that could slow them down for a second in order to get the things that you need. And if not, you already know what you need to do. It's time to replace them. A structured program with long-term success is ideal. You don't want to jump into something that as soon as you complete it, that it's over. You want to be able to continue to reach out for support. And hopefully your physician, that team is supportive as well. So let's talk about who are ideal candidates for remission. You see that? You are. If remission is a goal, it's a goal you can accomplish. But let's look at, based on some of the recommendations. Just because these recommendations are here, if for whatever reason you might not fit into the category, well, it just means we may have to do a little more work. A person who was diagnosed with type 2 diabetes within the last 6 years, there's clinical evidence on that. That person is still considered newly diagnosed in a sense, right? They're still trying to figure their body out. They're still trying to figure glucose out, glucose management out. So they're an ideal candidate. Someone who's not requiring insulin. Real important. Remember we said this takes that clinical team, because someone that's looking to make remission a goal, it's without medication. So there's some caution here. Someone who is willing. Now this says motivated. This is my slide. I'm going to change that. Willing and motivated to engage in lifestyle changes. Remember we said it does not have to be perfect. Identifying what area of your health are you good at and how can you build on it. And I'm going to say the other C word, y'all. We talk about consistency, but can we be committed to something? Your ability to stay committed to the support structures. So with diabetes remission, the program that helps you achieve it is actually a self-management program. It has a lot of the support players in place, but it also requires the support of your current clinician, because they're the person who's also responsible for some of your monitoring, right? Those appointments that are happening, whether it's every 3 months or every 6 months, depending on your needs. So this is where, if you fell into any of those categories where who's a good candidate, I mean, if you're willing to make those changes, if you can commit to a structured program, boom, there you have it. There's some that may need to modify the goal. And what does a modified goal look like? Well, the modified goal does not mean that remission is no longer on the table. It's on the table. But some modified efforts have to take place so that that person is able to stay healthy in the process. Someone who is insulin dependent. Someone who may have other complications. Someone who, it says, significant medical complexities. There are those, remember we just talked about metabolic syndrome. Maybe there are a few other aspects of the health that could complicate or that could make it more of a challenge. And then we have to think about how you can improve a person that will have to work harder on improving the control and reducing some of the risk reduction, right? Every person is different. So the beauty of this is from, a clinical perspective. If you are surrounded by a support team, a well-educated team, y'all, the road to type 2 remission, although it requires a joint effort, have you noticed that it is a holistic approach? And it is a holistic approach because it's going to involve a lot of the lifestyle work that you do in between those visits with your healthcare team. So remission is achievable, and we want more stories. We want more stories on remission because it can be done. It is lifestyle based. That's the foundation. So if you're talking the holistic approach, you want a natural segue to managing glucose levels, you just found it. And then, of course, that the ongoing support is critical so that you're able to maintain. That is the maintenance. You want to be in a position where you're able to maintain those results. Super, super key. So we're going to get into a Q&A in just a moment. We still have a few moments for that. I'm going to get ready to turn this recorder off, but I'm going to take a minute for those of you tuning in or you're listening to the replay. This is Type 2 Diabetes Remission, hosted by your girl, Coach Nick, with Amani Nicol Wellness. Throughout our conversation towards the end, you heard those key takeaways, but I hope that at the end of the day, you feel even more inspired to be able to level up that goal of glucose management to type 2 diabetes remission, and you are now ready to take that next conversation with your healthcare team to the next level and let them know what is on your to-do list to achieve and accomplish, because you know that it can be done in 2026. Stay tuned for the next episode. And as usual, make the day, make life by living beautifully well.